Hey, it's me again. In this video, we're going to talk about evaluation, how to evaluate someone. Evaluation is basically taking all the information and digesting it, analyzing it to come up with some type of outcome, cause, reason why something happens. This is rarely done in medicine or even in alternative healthcare, because what happens is they'll take the symptom and then they'll give you a treatment, whether it's a pill, a surgery, or even a vitamin. Right? So let's say, for example, you have low vitamin D levels. Well, then they give you vitamin D. Why? What causes? They don't look at aligning this like with an underlying cause, or why would you have this symptom in the first place? Vitamin D deficiencies can come from, yes, they can come from lack of sun, dietarily, but they also can come from high cortisol, which is the stress hormone, or it could come from a lack of digestive juices to absorb that vitamin because it's a fat-soluble vitamin. So let's say you have fatigue. Well, we can give you Red Bull or some stimulant, or we can find out, wow, maybe it's your sleep problem, or high blood pressure. Maybe it's a buildup of calcium in the arteries. Maybe it's an adrenal issue, but we don't do that. We just give the person a treatment, and for the rest of their life, they keep doing it. So here's what you need to know. Symptoms are effects. They're not causes. And when you treat the symptom, you hide the real problem, and you continue the problem longer. In medicine, they're basically made all the symptoms, effects, actual diseases, but they're really symptoms. And so that's why these people never get off the medication. So I'm going to take a case. Here's a case, a lady she's Paris, France, and I took her information. We're going to write all her information on the board to show you how I digest and analyze it and evaluate it. And I also have the blood test here as well. So let's see what we come up with in the next section. Okay, so what we're going to do is we're going to evaluate a case. I'm going to show you how we do this. The goal is to kind of take all the information and put it in buckets and see if we can align it with an actual cause. The problem with most people is they start treating each symptom separately. So this lady, particular lady, she's from Paris, France. She actually has all of her information right here, which I gathered, and her blood test. Okay, so we're going to take all this information and we're going to digest it and come out and see what we find. So the first thing I'll do is I'll put it in different categories or sections. I might put all the adrenal symptoms in a bucket, the thyroid symptoms, the menstrual cycle, pain, blood sugars, digestion, cognitive, circulation. So I'm kind of sifting it down, and I'll take a little piece of something, and then I'll try to understand it. We're trying to interpret what the body is trying to do with these symptoms. So the first thing I'm going to look at is that she has high liver enzymes, okay? So that's interesting. And then she has acid reflux, bloating, constipation, bad breath. Varicose veins is a liver problem. And coated tongue, that's a digestive issue. So we know bloating is decreased bile. Okay, bile is that stuff in your liver and your gallbladder that helps you digest fats. B-I-L-E. Okay, so that actually helps you absorb a lot of the fat-soluble vitamins. Okay, so we know that right there. Acid reflux could be an adrenal symptom. Okay, so let's look at the adrenal. Stress, sleep apnea. Now the interesting with sleep apnea is that is a deficiency of vitamin D and K2. Those are two fat-soluble vitamins. So that could align with a lack of bile, because without the bile you can't absorb these nutrients into the body, causing sleep apnea. Same thing with sinus. All right? So that's interesting. And then let's take a look at, she also has pain in the heart. That's chest pain, that's angina, and left arm. So that's more heart related. Now, one of the remedies, if you research angina, is vitamin E and vitamin E2. Those are fat-soluble vitamins. So that would align also with the low bile. That's interesting. Now, all of the fibromyalgia, that's pain all over the body. What treats that is a lot of fatty acids, some unsaturated fatty acids, omega-3 fatty acids. So a lot of the healthy fats, omega-3s, are anti-inflammatory. So let's just kind of assume that if she doesn't have the bile, she can't digest the fats to help her with the inflammation. So that's one cause. It could also be adrenal too. So I'm just sorting things out right now to see if it all connects. Oh, this is interesting. She's on thyroid medication, but she still has cold hands and cold feet and loss of eyebrows. Okay? So we know the thyroid actually converts T4 to T3 through the liver, through the gallbladder. And guess what that's involved with? The bile. So chances are this thyroid problem could possibly come from a low bile issue as well. That would align with the first thing I'm trying to look at here. Now let's take a look at this. She has to eat now, and if she doesn't eat now, she gets uncontrollable cravings, okay, sugar cravings. Well, what happens, that's a blood sugar problem. And what stabilizes hunger or cravings is the fats that go into the brain when you eat them, especially the fat nutrients to satisfy the brain. So I do know that she did mention that when she does protein and low fat, she has severe sugar cravings, okay, about an hour after she eats. So this is also a failure to digest fats, because especially if she eats and she's still not satisfied, that's really what's happening, or you're craving. It just means that she's not able to pull those fats into the brain and digest them to satisfy, so she's not hungry anymore. So that would explain this right here, this, because she craves cheese. It could also be low potassium, and it could also be adrenal as well. Now, look at this, high A1C. So that is a blood sugar issue. That's a higher sugar, but she has symptoms of low sugar. So we know she has a blood sugar issue because it's too high or too low. And that is going to mess with your cognitive function. So if you look at cognitive, she feels out of it, brain fog, no focus, no concentration. So right there, what I'm starting to think with here is that she's not getting the fuel to the brain. See, the brain runs on sugar fuel and fat fuel. And the problem with running in sugar fuel, which I think she's been running on, she's going to have highs and lows, brain fog, irritability all day long. So we need to switch her to basically the better fuel source, which is going to be ketones or fat. So that's going to handle the cognitive. Okay, so we have acid reflux, constipation. Well, guess what? If you don't have this bile, you have no lubrication for the bowels, so you're going to get backed up. Okay, and then you're going to, as a resultant of that, a chain reaction, you're going to get undigested food and bad breath, coated tongue, and also bile is very, very alkaline, and it neutralizes acid. So that could be, acid reflux could be a possible symptom of low bile too. Okay, so let's take a look over here. We have circulation, crampy calves. She mentioned basically she feels that she has low blood flow, severe deficiency of blood flow to her calves. But she really describes it as severe muscle cramp to the calf. So that might feel like a circulation, but it's a serious calcium and magnesium deficiency. Okay, and those minerals need vitamin D to absorb into the tissues. So this would make sense, because if she doesn't have the bile, she won't pull in the fat-soluble vitamin D3 to absorb the minerals, because the minerals are transported with the fat-soluble vitamins. So instead of getting her calcium, or magnesium, I would just fix the bile, because that would help her absorb the food that she's already eating and absorb the fat-soluble vitamins. So I really see so far she has a fat-soluble vitamin deficiency because she doesn't have the bile from the liver. Okay, so there's liver damage here for some reason. Now there's also a lot of adrenal symptoms right here. Can't sleep at night, extreme fatigue, and that right there is a high cortisol situation that could cause the bile problem in the first place. The other thing that could do it is this over here. Heavy cycles mean high estrogen. So it could be that the high estrogen from the cycle being out of balance, that could also interfere with the bile production, because women that are on HRT, hormone replacement therapy, that's high estrogen, or birth control pills, end up having gallbladder problems on the road as one side effect. So estrogen will affect the gallbladder. So again, it's all starting to unravel. This mystery is unraveling here. And so she's on Synthroid, which is thyroid medication, but it's not really working. And she can't sleep. That's why she's tired. So really what I'm looking at here is I would support the adrenal for sure. That seems to be at the root of it. But I'm going to give her some bile salts, purified bile salts. That should take a big chunk of this problem away, and then see what's left. So when you evaluate, you always take little pieces of it and you see if it aligns. And yes, this definitely aligns with the gallbladder and liver. And the bile also, even if there's scar tissue on the liver, like cirrhosis or fibrosis, one of the great treatments to break that down is the bile. Okay, so that's what we're going to recommend. We'll change her eating. We'll make sure that her breakfast is high in protein and fat, but we'll give her a little gallbladder support to digest that fat. And the other thing that we might want to do is make sure that she's consuming food with vitamin D, vitamin K2, and vitamin E3. But what I'd like to do is first give her this bile and see if these symptoms don't go away, because she might just have an absorption problem. Okay, so I just wanted to show you how I evaluate and just how I look at things, because the problem is we don't want to start loading up with a million pills and start treating symptoms. Okay, so I'll see you in the next video.